Can we just kind of touch as well on diabetes in the feet? Because that's a big issue with seniors. And some things people don't realize is in senior care, we can't cut the toenails of a diabetic. And can you kind of explain that and what foot care and diabetes, why they're so important?
Diabetes. Affects your kidneys, it affects your heart, it affects all of you. And so some people will be like, oh, well, my grandmother had diabetes, it wasn't that big of a deal, but it affects your whole body. And it's a way that you have to look at it. Some patients really don't look at it. I have patients who are type 1. They've been diabetic since they were 9. Tend to not understand with diabetes, and diabetics is the psychological aspect of it, of being systemically ill for a period of time. First and foremost, I don't think people don't think of that. They're just like thinking, I tell this person, this is what you need to do, and that you should do it. And it's really hard, especially when you have to give yourself insulin or finger sticks daily and do all of these different things. So you have But when you're not compliant, and hypoglycemia, when you're too low, can be just as bad as being hyper, which a lot of people are like, oh, no, I need to be low. I'm going to do this. I'm going to overtake my insulin. No, you can get really sick and you can die.
It's a balance.
It's
it's a balancing act.
Very delicate balancing act with diabetes. And diabetes, like I said, affects so much. But then with your feet, little things like I tell something happened, there was a trauma, you see more people with lower extremity amputations. And that is because it's further away from your heart. Okay. And sometimes with diabetes and poor circulation, the blood doesn't get there. So if we have somebody who comes in and doesn't really know what they're doing, they want to do the best that they can, and they don't know what they're doing, and they're digging into the skin, and that, or they're trying to pull an ingrown out that's in the skin. We've made a wound. And now that person is poorly controlled. They don't have proper nutrition. Their blood sugar, their hemoglobin A1C, not even their blood sugar, their hemoglobin A1C is 11. So they're running high. They're running like 320 on average. That wound may not heal. And so when you think like, well, mom and dad need to have their nails cut every 4 weeks and they should be doing this at the facility, you don't want that to happen. They do take care of the nails, close to the heart, okay? The foot could go bad very quickly. And so some people don't understand that. They think that, some people, caregivers are being lazy and things like that. No, they're being cautious.
Yeah.
They want to help your loved one. And that's why there's a certain way that you cut the nails and things like that. Like I told you about the little baby that I had, the baby with the ingrown. Who's seen a baby with the ingrown? He is literally 4 months old. He doesn't wear shoes. He doesn't do anything. His mom has the best intentions, cut the nail at the wrong angle and unfortunately on both feet, and the nail got infected on an infant. I've done it to my daughter. I've done it on her finger when she was an infant. So these little things, these are real things that can happen, and just you want to have somebody who's going to come in and look and spread the toes apart, because are they macerated? Are they wet in between the toes? Because that will make little cuts, which leads to that a nidus of infection right in between there. And then you have the little things on the heels. How are they, how are they positioned in the bed? Things like that. Or are they complaining that the sheets touch them? Sometimes they need a bed cradle, something that lifts the sheets off their bed. Yeah. So there's a lot that goes into diabetes, and especially with your feet, and especially losing, a lot of times you have that peripheral neuropathy, you don't feel as much. Some people can't feel the ground. They literally cannot feel the ground anymore. So then how are they going to be able to feel if they stepped on a nail? I've had patients that come in, they've got a wound because they went to go visit their grandkids. They went to go visit their kids, and they're putting together a model train set. Literally, this happened with their grandson, wanting to spend that time. Get home, take their shoe off, there's blood. Oh, wow. They had a nail through their foot and had not known it. They like to wear shower shoes. They like to wear the soft Crocs. They like to wear these things. And they didn't know this whole thing had flipped and just a nail had went through their foot.
And as much as you don't want to feel that, you need to feel those
You do.
things.
So then
he
literally had to pull the shoe off with the nail. And
that's the nightmare.
Yeah, and that didn't heal. That was 8 years.
Wow. So, a lot revolves around your feet.